And with that, I'll turn it over to Senator Murray.
Well, thank you so much to all of you for joining us today ahead of the anniversary of the Roe v. Wade decision this coming Saturday. And I want to thank all of you who have joined me today to speak. Really appreciate all the work that you're doing to protect the right to abortion in Washington State and across the country, and make sure that everyone gets the reproductive health care that they need and they want. So I'm really grateful for all of your willingness to share with us your experiences today, which I know can be deeply personal. So let me start by sharing a story that is very personal to me too, one that has really informed my work and my values ever since it happened. Back when I was in college, a good friend of mine, she lived in the dorm with me, was raped and she got pregnant. And that was before Roe v. Wade. So she had nowhere to turn that she knew would be safe. And she didn't have a lot of money, so she couldn't afford much either. And the procedure that she ended up getting, a backstreet procedure, ended up leaving her at a very young age unable to ever have children. She was hurt, she was frightened, and she was forced to go through this truly horrifying experience by herself, because she had no ability to make her own decision about her own body, her health, and her future. One of the most personal decisions a person can ever make, simply because she didn't have the money or the connections. So her experience really stayed with me to this day as really a constant reminder. People should get to answer their own questions as personal and important as when or whether or how to get pregnant, rather than having those decisions just simply made for you because of how much money you have or where you live. And since then, since that time, Roe affirmed the constitutional right to abortion. And it was really a giant leap forward, that landmark case, because finally patients were able to get decisions that allowed them to stay healthy. It opened doors for women to pursue their career or their education goals on their own terms. And it affirmed that everyone has the right to make a decision about their own body. But as we all know, this is now under attack. And actually, it has been for some time. For years, we have seen extreme Republicans peddle misinformation and fill our judicial system with anti-abortion judges and pass laws that limited abortion access and restricted people's autonomy, laws that are now hurting people of color, people in the LGBTQI+ community, immigrants, young people, people with low incomes, people with disabilities. And now the Supreme Court greenlit that law in Texas that essentially bans abortions and forces patients to be pregnant when they don't want to be, all under the threat that complete strangers can file lawsuits against a patient's friend, family, doctor, or nurse just for giving them support or medical care. Well, thankfully, in our state of Washington, we have the protection for the right to abortion. But right across the border in Idaho, Republican state lawmakers have already said they're going to pursue a law similar to the one that's on the books now in Texas. And this summer, the threat is real, that the court could erase nearly 50 years of precedent, overturn Roe, and end the constitutional right to an abortion. So this is not a drill. Abortion access is being dismantled right before our very eyes. 36 million women, nearly half of the women of reproductive age in the US, could lose access to abortion. And along with everyone on this call with me here today, I'm here to make it very clear that that is absolutely unacceptable. The majority of Americans want to protect Roe. They want to live in a country where everyone can make their own decision about pregnancy and parenting and have control of their own bodies and lives and future, free from political interference. That's why Democrats in the Senate right now are fighting very hard to protect the right to abortion at the federal level by passing the Women's Health Protection Act. That is a bill that will safeguard Roe and help make its promises a reality for everyone, no matter their zip code, by ensuring the constitutional right to abortion is not undermined by local abortion bans and restrictions. And I want to be absolutely clear. I am doing everything, every way I can to protect reproductive rights in this country, whether that is pushing for over-the-counter birth control or making an historic investment in Title X family planning services so patients can get birth control or cancer screenings or a lot more. And I am not backing down. Abortion is essential health care, and I will be fighting tooth and nail to protect it. And I'm so grateful to everyone who's in this fight with me. So with that, let me turn it over to our first guest, Dr. Bayuszik.
Thank you, Senator Murray. My name is Dr. Denise Bayuszik. I'm Chief Medical Officer for Planned Parenthood of Greater Washington and North Idaho. I'm zooming in from our beautiful Spokane Health Clinic, and it's an honor to be here today. First, I want to say Senator Murray has been a steadfast advocate for Planned Parenthood patients here in Washington State and across the nation, and has played a critical role in both protecting and advancing access to reproductive health care. Like the majority of Americans, Senator Murray understands that these are decisions that belong between a patient and a provider, not politicians. As we recognize the anniversary of Roe versus Wade, we must be clear that access to abortion is at risk like never before. For us in Spokane and across our affiliate, if the Supreme Court overturns Roe versus Wade, we anticipate the number of out-of-state patients to dramatically increase. Right now, between 30 to 40% of abortion appointments at our Spokane Valley Clinic are for Idaho patients. In Idaho and in many other states, abortion is already inaccessible for many. Last spring, Idaho's governor, Brad Little, did sign a law that could ban abortions at about 6 weeks, which is before most women even know that they're pregnant. That law made Idaho one of the 26 trigger states where abortion would be essentially illegal 30 days after the Supreme Court overturns Roe versus Wade. We know that patients will come not just from Idaho, but from all over the country. We recently saw a patient from Texas who first traveled to Kansas and then to Colorado. Eventually, our affiliate was able to provide the care they needed, but it is just so sad to see this unfold. The Guttmacher Institute has estimated that if Roe is overturned, demand for abortion in Washington state could increase by 385%. That's right, 385%. But we're not backing down. We are proud that we have kept going strong during the pandemic and have expanded access to abortion services. We increased access by adding the option of patients being able to access medication abortion without having to come in person to the health center. Furthermore, we expanded the number of our sites that provided these critical services. This really is an all hands on deck moment. At Planned Parenthood, we don't stop fighting just because there are obstacles. We wouldn't have anything. Abortion access, copay-free birth control, Planned Parenthood's health centers, any of it, if we only fought the easy fights. We believe that all people deserve access to healthcare without barriers or political roadblocks. We should all have the freedom and power to control our own bodies and our own lives. Abortion is healthcare, and access to abortion is essential. We will be here for you, no matter what. Anyway, now I'd like to turn this over. I'd like to introduce Emily Marven, a student at Whitworth University, who will be sharing a story. Thank you.
Thank you. Yes, as just mentioned, my name is Emily Marven. I am a student at Whitworth University, and I live in Spokane, and I lead our college chapter of Planned Parenthood Generation Action, and we're a network of young activists. We organize events on our campuses to mobilize advocates for reproductive freedom, educate young people about sexual health, and create lasting change in our communities. And I also am a proud Planned Parenthood patient. As a patient, I really value the care that I've received at Planned Parenthood, even though some days getting past the sidewalk of anti-choice protesters running all towards my car at once makes my blood pressure increase. And I know this about my blood pressure because I often have to have it remeasured at the end of the appointment because it's very high at the beginning and it doesn't seem fitting. I've always felt very respected and seen at Planned Parenthood, whether it be my gender identity and pronouns being a part of the appointment in ways that I want, the information I receive that I trust to be complete and informed, or the way I know that I'm always in control of the appointment, which is important to me as a person that's dealt with trauma. I don't know what I would do without Planned Parenthood. So this experience brings me to imagining a world where access to healthcare like I receive at Planned Parenthood is no longer a privilege, but instead a right. This brings me to imagine access specifically to abortion care as equally accessible and deemed essential because abortion is essential care. Everyone should have the freedom and power to make their own decisions about their bodies, lives, and futures. This shouldn't be politicized, but we are thankful for Senator Murray's leadership. Now is the time for Senate to pass the Women's Health Protection Act as soon as possible, and for lawmakers at all levels of government to ensure everyone can make their own healthcare decisions without political interference. We don't have any more time to waste. Thank you. I'll turn it over to Lili.
Thank you so much, Emily, for sharing that. Good afternoon. My name is Lili Navarrete, and I am the Director of Public Affairs of Raiz at Planned Parenthood of Greater Washington in North Idaho, based in Spokane. In addition, I represent the Governor's Office for our region on the Commission of Hispanic Affairs, and am the Social Justice Director of the Hispanic Business Professional Association of Spokane. My work at Raiz is breaking down barriers in accessing healthcare in the Latinx community. The Raiz program is about more than just health. It's about justice, knowledge, and power. I work directly with members of our community in Eastern Washington, and every day I see how important access to family planning, including abortion, is. This care allows people to keep themselves healthy and to plan their families and their futures. It is especially important for communities of color due to centuries of systemic racism in our public health and economic systems. The pandemic has made existing health disparities even worse, and it has decreased access to basic reproductive health care while also increasing uncertainty as people plan for their futures. For example, about a third of women have experienced delays or cancellations of needed reproductive care during the pandemic, and that number jumps to 38% for Black women and 45% for Hispanic women. Protecting access to abortion has never been more critical than right now. I would like to thank Senator Patty Murray for her leadership, for standing with Planned Parenthood. We must work together to lay the groundwork for expanded abortion access in the future and build the movement. We know the next few months will be hard, and we will be right here with you every step of the way. Thank you. I'll pass it over to Amir now.
All right, so we have time for a couple of questions from the reporters that we have with us on today's call. If you have a question, please just use the raise your hand function, and we'll call on folks in the order that they raise their hands. You should see that at the bottom under reactions. All right, we have one from Alice with Politico.
Thank you so much for holding the call. I wanted to ask Senator Murray, a lot of times this has been framed as something that would impact the states that are, would likely ban abortion should Roe versus Wade go away. And I wanted to hear from you how this would also affect states that support abortion rights as well, and why everyone in every state should be aware of this.
Well, everyone in every state should be aware of this, because this erosion of a woman's ability to get the health care that she needs can come to any state at any time merely by a political whim of a state. And secondly, we're seeing these laws become more and more aggressive, even to the fact that they're dealing with a woman's right to get her own birth control. And third, I would say, because probably our providers on the call can tell you even more, when Texas law went into effect, it impacted our providers all the way across the country in Washington State because patients were coming there. And the more crowded and in line people are, the harder it is for local people to get an appointment and get the care they need. If we change this country so that it's by states, we virtually will be making women have to come up with the money, travel everywhere, and and to the few states that would provide the care, it would have a huge impact to them. It's just not what our country should do.
All right. And I see we have a question from Samantha with the Inlander.
Yeah, thank you. I was hoping to ask Dr. Bayuszik. I know you sort of mentioned the local clinics here in the Spokane area already see patients from North Idaho and other states. And I'm wondering if you can speak a little bit more about why we'll be expecting more patients if Roe is overturned, and how far away you think they might be coming from.
We'll see the Idaho patients, or right now that we see are typically from North Idaho, but we may see them from other parts of Idaho. And then also more from Montana. Maybe Paul can help me with some of these numbers also, but that's what we're anticipating, that there's some rollover from other states.
Yeah, thank you, Sam. We have certainly seen a lot of patients from Idaho. We would expect to see a lot more coming from Boise. Boise being the biggest urban center in Idaho. It takes about 5 hours to get from Boise to Kennewick, which would be the closest site to perform surgical abortions. And again, that is not an easy drive. That would be about 10 hours round trip. And then in addition, with Montana, they've actually started to, since their legislature has flipped, introduce a couple policies that have certainly been copycat legislation from other states that we've seen. They've introduced trap laws, parental notification, a 20-week ban. And we know that, as we've seen in other states, that is a slippery slope. So it is definitely concerning. We, again, have seen patients already from Montana, but given this state-by-state patchwork approach, we would expect to see more. And again, as Dr. B mentioned, we have already seen patients from Texas at our affiliate.
All right. I don't see any other hands up, but I'll do just one last quick call for any reporters on the call with us who have a question for any of our speakers.
This is Sam with the Inlander. I would have one more for Senator Murray.
Sure.
Can you speak about where in the process we're at with the Women's Health Protection Act, and what, if any, barriers you're seeing to getting that to move forward in the Senate right now?
Yes, thank you for asking. It has passed the House, so it has to pass the Senate in order to go to the president. We are working to get floor time in the Senate right now. As you know, we've had a lot on our plate. We are hoping it to move to the Senate, and what we're in the process right now is talking to our colleagues on both sides of the aisle to make sure we have the support if we can get it to the floor.
All right. And not seeing any other hands raised. So just a last final call for any questions. If you're having trouble with the raise your hand function, would just go ahead and unmute now and just let us know what outlet you're with and your name. Okay. Seeing no other questions, I'll turn it over to Senator Murray for closing remarks.
Well, thank you so much. And I really want to thank all of our folks who were panelists and spoke today for your work every day for women and men across this country. You make such a tremendous difference. And I think that I'll just end with this. The value that we are trying to protect is to make sure individuals can make their own healthcare choices based on their personal decision, their partner and themselves decision, their religion and their decision, and their doctor and their decision. To have this decision made by a politician at any level, to me, is abhorrent. It's a hard enough choice for someone. Let's make sure they've got the right to have a healthy choice in front of them, not decided by somebody who is elected politician.
All right, thank you. That concludes today's call. This was recorded. We will distribute this recording widely. And if you didn't get to ask your question, you know where to find us. Thanks, folks.
Thank you.